ADHD is the most common reason children are referred for mental health services. According to Mental Health America, or MHA, 1 in every 20 children have or are diagnosed with ADHD. Ever since I started in the early childhood education program, I was interested with children who had disabilities. Now that I'm in my exceptionalities class, I have been more interested in children with ADHD, and that's when I decided to do my research upon that. So today I want to inform you about children that have ADHD. I want to inform you on the 3 types of ADHD. I want to inform you on how it is diagnosed and the myths behind it that you may have heard. So first, let's talk about the 3 types of ADHD. The first type is inattention. It is often overlooked because children are not disruptive. They may not follow rules and instructions very well, and they may appear to not listen when spoken to. The next one is hyperactivity. It is considered when the child fidgets or squirms or tends to move around a lot. They are constantly disruptive, and they have difficulty playing with others. The next one is impulsivity. It is when the child acts without thinking. They often have difficulties keeping their emotions to self, which means if the child tends to get into trouble, they may be more likely to lash out than the normal child. So now that we've talked about the 3 types of ADHD, we're going to move to how it is diagnosed. The average age a child is diagnosed is age 7, according to helpguide.org. There is no single test to test whether a child has ADHD or not. So a parent needs to observe their child for at least 6 months, and then when they think that their child has most or all of the symptoms of a child with ADHD, they need to go see their pediatrician. Once they have seen their pediatrician and they have decided that the child has ADHD, then that is when they will be sent to a specialist. There they will be diagnosed with it. So now that you know how it's diagnosed, we are going to talk about how you may have heard some of the myths. According to healthychildren.org, almost all children have times where their attention or behavior veers out of control. So the first myth that you may have heard of is all children with ADHD are hyperactive. This is not true because children that are hyperactive, children with ADHD may not be hyperactive. They may have their mind wandering and other times be just sitting there, but their mind is not focused on their paper. The myth number 2 is they could change if they wanted to. Children with ADHD may not be able to change and may grow to still have ADHD. They will not grow out of it. Myth number 3, medication is the best treatment. Medication may not be the best treatment because the child may just need behavioral therapy. They might need behavioral therapy along with medication, or also nutritional diets and exercise. So now that you may know a little more about children with ADHD, I have informed you of the 3 types, the diagnosis, and the myths. I hope you understand now why ADHD is so common to be referred to health services.